Sawadika and good afternoon. Thank you for tuning in today to the English language summary of the press briefing by the Center for COVID-19 Situation Administration, or CCSA, for Thursday, the 31st of March, 2022. Before going through the usual updates we have prepared for you, let me sum up some of the points of interest for our English language audiences from the Thai briefing. And that is namely that the CCSA meeting followed very closely what is happening in countries around the world with a high rate of infection. Certainly many countries are now shifting a focus from following that rate of infection to following the rate of fatalities, but there still is a need to understand what is happening in terms of infections. And the countries topping that list currently are the Republic of Korea, Germany, France, and a number of countries in Europe, namely UK as well, Italy, and the Netherlands. In the US, it was discussed the subvariant of Omicron, designated as BA.2, is becoming responsible for the majority of infections. It has a high transmission rate, and they are following that development closely there. Let me turn now to our usual updates, and that is first to confirm for our English language audiences that the new updated measures for international travelers entering Thailand will be effective from tomorrow, the 1st of April 2022 onwards, as it has now been officially announced in the Royal Gazette as of yesterday. So we have a slide coming up for you very shortly to recap those measures, which I'm sure many of you are aware of already. So from 1st of April 2022, travelers entering through all schemes will no longer require a pre-departure RT-PCR test within 72 hours of travel. However, there will be a requirement for travelers to undergo the PCR test upon arrival in the country and to take a self-administered ATK test on day 5, reporting that through the MorChana application. In addition, travelers entering Thailand through the Sandbox or alternative quarantine schemes will be required to quarantine for a decreased number of only 5 days. I'm sure many of us traveling ourselves or expecting families and loved ones to visit us will appreciate the slightly relaxed measures for entry. And please rest assured that this relaxation has been carefully considered by the authorities for the best way forward, safely, that is, for Thailand. We continue to monitor very closely the situation in other countries, which are both lifting measures and in some places reinforcing them. Should the situation improve for us here, which we do very much hope and expect to at the same time, there will certainly be a further review of these measures so that we can return as soon and as safely as possible to a more normal situation once again. So please bear with us as we focus now on reaching the plateau stage of infection soon to get us even closer to endemic stage by July of this year. Let's now turn to the other usual updates we've prepared for you with the latest figures on entry into Thailand. And another slide that's coming up for you shortly, that during the 1st to the 30th of March 2022, and there's that slide right there, 262,311 travelers entered Thailand. Of this number, the majority, or 236,765 travelers, entered via the test and go or quarantine exemption scheme. 21,500 entered via the Sandbox scheme, and the remaining 4,046 entered via alternative quarantine. During that same time period, 1 to 30 March 2022, the majority of travelers are from these top 10 countries of origin that you see on screen, namely Singapore, Germany, the UK, the Philippines, the US, UAE, France, Australia, India, and Israel. I note that we have 2 countries there from ASEAN, so happy to see an uptick in travel in the region. Let's now move on to the COVID-19 situation in Thailand, the general situation that we bring to you every week, which is that today, unfortunately, we are experiencing a new high in terms of confirmed cases during the last 24 hours. Let's help one another continue to strictly comply and practice disease control measures and follow universal prevention, especially as we are headed towards a long holiday, which could lead to a high risk of spreading COVID-19. We have the new recoveries there, quite a high number as well. Happy to note that, with 25,077 cases, and then the new fatalities, unfortunately, still logging those at a relatively low number of 85 cases. With regard to the fatalities, the CCSA noted that most of the fatalities are people who have not been vaccinated or who have received only one dose of the vaccine. So if you know anyone over 60 years old or someone with underlying medical conditions, please encourage them to get vaccinated as soon as possible. Another note that I'd like to make on fatalities today is that we are aiming for fatalities to be stable at a rate under 80 per day, which will help us to reach endemic stage much sooner. So currently we are not too far away from that goal, and we'll be looking at that number very closely. Let's have a look now at the list of top 10 provinces, and there you have it on screen with COVID-19 cases. A number of those in red, unfortunately, which indicate an increase from the previous day. And you see there on top of the list, as usual, Bangkok, followed by Chonburi, Nakhon Si Thammarat, Samut Sakhon, Samut Prakan, and the list goes on. Let's now look at the vaccination progress with another slide. And you see there that yesterday we administered 290,459 doses of the vaccine, increasing the accumulated number of vaccinations to 129,362,028 doses. This brings us to 79.8%, or over 55 million people of Thailand's population having received their first dose. 72.3%, over 50 million people having received their second dose, and 33.9%, which is over 23.5 million people having received their third dose. Our vaccination drive is progressing fairly well, and we continue to underline that vaccinations are an important tool in terms of prevention. At the same time, we're also here in Thailand focused on treatment, which will help support our efforts to reach endemic stage. In fact, and there is a slide coming up very shortly, I am pleased to share with our English language audiences that Khon Kaen University has launched a throat spray containing Pha Thalai Chon, or green charetta, which has proven to inhibit the spread of COVID-19 in the mouth and throat. Researchers say the plan is to distribute the throat spray in 10 milligram and 20 milligram bottles next month. Some have already been sold at Si Nakharin Hospital, at the university's Faculty of Medicine, and drugstores run by the university. Another slide coming up for you as well, and that represents a story that we have for you, that the cabinet has approved a 500 million baht budget for the purchase of Paxlovid antiviral medication for treating COVID-19 patients. Paxlovid has been shown to have one of the highest efficacy rates in combating the coronavirus, reducing the risk of hospitalization or death by around 88%. The procurement will allow public health officials to provide additional COVID treatment options for patients, which at present we are utilizing the green charetta, Favipiravir, Molnupiravir, and Remdesivir to treat those with mild conditions. So this would be another tool, another important tool in our toolbox. Before concluding today, let me alert our friends in Thailand, many of whom I'm sure would know from having lived in the region for a long time, that the rainy season is upon us very soon and will bring with it additional health concerns. Specifically, the government has expressed concern over seasonal dengue fever and other risks that come with summer thunderstorms this year. As flooding and rainstorms create stagnant water in many areas, they could very well become breeding grounds for mosquitoes that transmit viruses, such as the type that cause dengue, malaria, and other vector-borne diseases. So please remain vigilant and monitor your health closely amid the ongoing COVID-19 and influenza outbreaks. If you experience high fever or fatigue, please take an ATK test and monitor yourself for any symptoms. If the ATK results come back negative, but the symptoms persist after 48 hours, do see a doctor as soon as possible. Before closing as well, a short reminder that with Songkran coming up, please do observe all of the local restrictions in terms of water splashing. And you have a very lovely slide up for you right now to run through those restrictions and measures. Firstly, that traditional ceremonial water splashing or rotnam is allowed as long as complying with COVID setting measures. Secondly, foam parties, drinking alcohol are not allowed on venues, in specific venues. And thirdly, closed spaces, please wear your mask and please practice social distancing. And the last bullet, no water splashing in public spaces. That's all I have for today. We can certainly still celebrate with our loved ones, but we should be doing so to usher in the Thai New Year safely and mindfully. Thank you for tuning in today, and we will see you again next week. Before then, stay safe and take care. สวัสดีค่ะ